J-Cannula, tighten, look at the light. Keep looking at the light, my friend. So, lower nasal, upper nasal, subincisional. So you get nasal and posterior capsule polish. I'm not take anything with you. Okay.
VFX is 1.3.
So J-Cannula, upper nasal. Look at the light. See it lifting off. There you go. Some subincisional. There you go. Look at the light, my friend. Look down a little bit to the light. There you go. Feel a bit of pressure now. That's normal. So upper nasal. There you go. Change direction. Lower nasal, subincisional, nasal, and posterior capsule polish. There we go. Don't turn your head, just come towards me here. Yeah, okay. Okay, can let go. Okay. Yeah, sure. So lower nasal.
0.8.
Okay. Upper nasal. Nasal. Subincisional. Upper nasal. And lower nasal. Some polishing. Subincisional. Some of that is just a scar tissue. You shouldn't try to take it off all because you can actually open the capsule to leave.
That's fine. If you want to finish this one, you can just do that one.
Some pieces in the corner there, just clean it up. So you can use the J-Cannula more from that. So it rotates and comes from the other side. And then change location. The upper nasal, subincisional, nasal, and PC polish. And that's sleeve. That's good.
They didn't come with one, so I took mine. They're like, really? I said, yeah.
it's funny how things don't get communicated.
No. Like, I will not forward your blood pressure cuff.
You know, what I'll do, I'm gonna create a cheat sheet and I hang it, make it a. No, nasal, PC polish, southern sigil. Doing great.
0.7.
Okay, so that's good. You can open the lens.
So you have EFX of 1.0.
So you start in the middle, slide to the angle, to the fornix. Not sure why they will close down like that. See, I press on the wound just to get the proper location. Go in. Now I'm in. And do upper nasal. And press on the window slightly to allow the egress without having the chamber to be too deep. Same thing here. A little bit of a polish. Incisional. Yeah. Okay, so okay, J-Cannula.
Oh, 1.6.
So go slide, go upper nasal, eject, lower nasal. Incisional, polishing. Okay, that's good, nice and clean. Okay, lens, thank you. Start from the middle and then slide it to the corner, to the lower nasal, irrigate, okay. Change location, upper nasal, the nasal part, then capsule polish, subincisional, okay. Doing great. Everything's good. Oh well. Try to look at the light. Here you go.
Yeah.
Take this piece out. Location. Okay, can take this piece with me. Try to struggle with these pieces and open the capsule. So You can come here, upper nasal. You can get it out that way. Now lower nasal. Okay, that's good. And nasal. Some polish. And take this piece with you. So there's an opening here. Just drag it and go to the fornix and then inject. So relocate. Do the same thing. Drag it to the fornix and then inject.
All my teams, I got players on loss last night.
They did.
We did.
Oh no.
I know.
Do you have any senators?
No.
They played in there.
Yeah. I got scanned home from Carolina.
Always watch the incision when you do this. Make sure this you don't start to get prolapse. So, again, this is medium pupil, but not an IFIS. Okay.
And Danielle was calling me yesterday. Hey, Danielle was there.
Subincisional. So when you do these, you go from the middle, slide it to the inside, behind the back, behind the iris. Okay, just clean up some of this stuff here in the front.
Point 8.
So watch the wound, make sure it's not prolapsing. Go from the center, go to fornix, and inject there. Although you don't see it, but as you can see what's happening with it. Now change location, do the up. Oh, look at the light, look at the light, here you go. Subincisional, you're good? We're almost done, by the way. Okay. Let's take this with us.
3.0.
Point 4.
Okay. Gonna go in, go upper nasal. Okay. Okay. Locate. Lower nasal. Clean up. Subincisional. Get out. Look at the light, my dear. There you go. Let's get that out. Yep, yes. So J-Cannula, go in, go to the lower nasal, irrigate. Okay. Now relocate, upper nasal, and this dislodge, a little bit of polishing, subincisional.
EFX 2.0.
Look at the light meter. There you go. Go this gap here. Inject. See, it's coming from the other side. There you go. Relocate. Went underneath this. Right, because lift off. Okay.
X of 0.2.
Thank you.
So, relocate. Try not to move it, my dear. You're doing great.